Let's be honest, we all know a shift starts before you even step foot on your unit. What you wear sets the tone for your entire day. And that's why I love Figs. Figs make scrubs for modern medicine. Back in nursing school, I was handed boxy, scratchy scrubs that felt like wearing a paper bag. Figs changed everything. They're form-fitting, insanely comfortable, and actually made for people who work in healthcare. They're antimicrobial to help keep you protected, durable enough for wash after wash, and look so good you actually want to wear them. If you're getting your first set of Figs, I'd go for the Catarina top and the Cade pants. The Catarina has this easy, relaxed fit that I love, and the Cade has cargo pockets for everything you need within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off. Today's episode is sponsored by strawberry.me. So this one's for my working nurses out there. I want you to sit with 5 quick questions for a second. And these are, am I growing or just repeating the same experiences on a loop? Am I energized by my work or feeling constantly drained? Are the skills I'm building going to matter in 3 to 5 years? Do I actually know my next career move, or am I just waiting and hoping? And if I stay right where I am for another year, will I be proud of that, energized by that, or will I regret playing it safe and stuck in a burnout loop? So if those questions hit you a little bit differently than you expected, strawberry.me is worth checking out. Their career coaches work with you one-on-one to get clear on where you're headed and build a real roadmap to get there. No vague advice, an actual plan. Take control of your future at strawberry.me/nursemo today and get 50% off your first coaching session. That's strawberry.me/nursemo. Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. Today, we're talking about why low albumin causes edema. And this is one of those really great one concept explanations that makes total sense once the mechanism clicks, and then you basically can't ever unsee it. So, first, what is albumin? So, albumin is a protein. It is a very abundant protein in the body, in the blood plasma, and it's produced by the liver. And it does some really important jobs, but the one we care about the most for today's episode is that albumin is responsible for maintaining oncotic pressure inside your blood vessels. So what does that mean? So go back in the way back machine and go back to your anatomy and physiology classes where you learned about oncotic pressure. So imagine your bloodstream as a highway running through your body. Running alongside that highway is tissue. It's the interstitial space where your cells live. Fluid naturally moves back and forth between your blood vessels and that tissue space. And 2 opposing forces govern that movement. Hydrostatic pressure, which is the actual pressure of blood pushing outward through the vessel walls, and oncotic pressure, which is the pulling force that keeps fluid inside the vessels. So albumin is the main driver of that oncotic pressure. It's a large protein that cannot cross the capillary membrane easily. So it stays in the bloodstream and acts kind of like a magnet, pulling water toward it and keeping fluid inside the vessel where it belongs. Think of it kind of like a sponge in your bloodstream. It's going to hold fluid and keep it from leaking out into the tissues. So, what happens when albumin is low? So, when albumin levels are low, that action of the sponge, that oncotic pull, weakens. That magnet, that sponge, whatever you want to rethink of it as, is losing its strength. Now, hydrostatic pressure is still pushing fluid outward, but there's not enough albumin to keep it in. So fluid leaks out of the capillaries and into the surrounding tissues. And that fluid buildup in the interstitial space is edema. And because this is a systemic issue, meaning albumin is low throughout the entire body, you often see pretty generalized edema. The classic presentation is bilateral pitting edema in the lower extremities, but you can also see ascites, which is fluid in the abdomen, and in some cases, pulmonary edema. I've seen edema so severe that the entire patient is just so puffy and swollen that blisters are starting to develop on the skin where fluid is leaking out. So, edema can range again from mild to incredibly, incredibly severe. So let's take a look at how this happens or when this happens clinically. So low albumin shows up in patients who can't make enough or who are losing too much. Common scenarios you'll see are liver disease. So the liver makes albumin. So cirrhosis, liver failure are going to lead to low albumin levels. Malnutrition is another very common reason. Albumin requires protein to synthesize. And if you're not taking in enough nutrition, bam, you end up with a low albumin level. In nephrotic syndrome, the kidneys lose albumin in the urine. And in chronic illness and inflammatory states, the body redirects resources, suppressing albumin production. And in burns, the individual has massive protein losses through the skin. You'll also see this in your patients who've been hospitalized for a long time. Low albumin is really common in hospital settings and is actually associated with worse outcomes. So, as a nurse, here's what you're thinking about when you see a low albumin level. First, you should expect some edema, so make sure you're looking very closely for it, head to toe. You want to know, is it pitting edema, non-pitting edema? Where's the location? What's the severity? How is it affecting the patient? Second, think about medications. Albumin is also a carrier protein for many medications, including things like warfarin and the anti-seizure medication phenytoin. When albumin is low, more free drug is circulating, which can increase drug effect and toxicity risk. This is really important with medications that have a narrow therapeutic window. Third, wound healing is impaired. Protein is, as we all know, essential for tissue repair. Patients with low albumin are at higher risk for pressure injuries and slower recovery. Fourth, you are always going to be collaborating with the dietitian because nutrition is really important. These patients need protein rich nutritional support. And in many cases, it's in the form of some kind of protein supplement, like a protein shake, something like that, like Ensure or what have you, whatever your hospital utilizes. And then fifth, you want to look at the underlying cause and treat that as well as you can. The edema is a symptom. You're treating the low albumin and the condition causing it. So I hope this sheds some light for you on albumin and how and why it causes edema. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
This Father's Day, when you ship UPS Air at the UPS store, your items arrive on time or your money back, guaranteed at no extra cost. It's like the father of all shipping services. It shows up to the airport way too early, just to play it safe. It's overprotective about all the things that truly matter, and it's always prompt, especially to be with family. Make it your first choice to celebrate your dad. Ship UPS Air with our money-back guarantee, exclusively at the UPS Store U.S. retail locations. Visit the upsstore.com/airshipping for full details. Terms and conditions apply.